Back now on Triad Today, we'd like to spend the next few minutes talking about a wonderful program. It's the Cancer Patient Support Program at Wake Forest Baptist Medical Center. And we have a very special guest with us now that's going to help us through this topic. Richard McQuellon, of course, Director of the Cancer Patient Support Program. We welcome you to Triad Today.
Thank you, sir. I'm just glad to be here.
And we've had plenty of your colleagues here that you've mentioned, so we're glad to have you for the first time. Give us just a quick 10 seconds or so on what the program is all about in case someone's just moved into the area.
It's a program of people helping cancer patients manage the initial diagnosis and treatment through survivorship. It's people meeting and talking and listening to people.
Now you and Justin Gomez each sent me some emails, and I looked at one of them and it said, be sure to ask Richard about Winterlark. So tell us what Winterlark is.
Well, Winterlark is the lifeblood for the Cancer Patient Support Program, as it provides approximately 50% of our operating budget. It's has been a gala ball fundraiser with over 500 people, but of course this year with the pandemic we can't do that, so it's a peer-to-peer activity now. It is the philanthropic arm of the institution that helps us. The Office of Philanthropy and Alumni Affairs are really the backbone behind that activity. Without them, it's difficult to have a program.
Yeah, because a lot of people might just assume that, hey, it's a great program, but since you're such a big university, big medical center, I'm sure that that's all covered, but you do. You rely on the donations, you rely on the fundraiser. Now, how can the community participate? What I picked up on as I'm asking about participation is we're in this pandemic virtual world now. How can people jump in and help with Winterlark?
Well, there are peer-to-peer groups that they can connect with, and I'm sure there'll be a link that will be shown to folks in a minute. This is a unique partnership. Unlike any in the country, really, you have community volunteers. In fact, the roots of the program are in volunteers who saw a need for emotional support for cancer patients in the early 80s. So the community came together with this institution, which also participates with support in our program as well, to form a unique connection with our cancer patients to help heal. Basically, we try to improve quality of life and reduce suffering, mainly through listening. Our volunteers are really phenomenal people. Of course, with the pandemic, and that's you mentioned just a moment ago, that has made things much more difficult, which is why the peer-to-peer fundraising is important and why we're looking forward to some return to normality, because our volunteers are the heart and soul of our staff. One of our volunteers is fond of saying, I may not be able to do great things, but I can do small things with great love.
Isn't that
and that's
something?
That's really the center of the activity is loving, caring for patients in a listening way. Listening carefully, responding thoughtfully.
Why is it so important, especially in times where we do have a lot of people still unemployed and suffering in many different ways? If you do have something you want to give, why is it important to give to this program?
Well, there's so many stories to tell about patients. We're so lucky, all of us. Many of our patients have difficulty with transportation. So we provide funds to help people travel from some of the further reaches of our catchment area.
For doctor's visits and things like that?
I'm sorry?
For doctor's visits or going for treatments or?
Yeah, for treatment visits, for
Yeah,
sure.
yeah.
And it's really hard to really believe that's happening now for so many people. The resources are drained, and we are fortunate to have resources. We can help people, and we can do it quickly. Sometimes the social service network takes time. We can do things immediately.
Before time gets away from us, I want to mention a couple things. Of course, the general website is wakehealth.edu, but wakehealth.edu/Winterlark is a specific website that will take you to this, and please check that out. They're doing such great work to support cancer patients and their families, and I just appreciate everything you're doing, and I hope you'll come back and give us an update on it. Thanks, Richard.
Thank you, sir. I'm glad to be here. I hope I never see you in our medical center except as a visitor.
Understood.
Okay.
Thanks for everything.
Thank you.